I feel so guilty because I brought home the disease to my husband or to my children or to my wife or to my parents, elderly parents, and I killed them.
In the first surge, there was more hope, there was faith, more patients going home. In the second surge, I don't know what was going on. It was just like a purge.
As COVID-19 rampages through South Africa with its second wave, our health workers are witnessing the trauma the virus leaves behind. The pandemic has taken a toll on them physically and mentally, with many of them failing to seek help in the interest of saving lives. We spoke to some of them and they opened up about the devastating realities of COVID-19 that they face.
This year has been the most traumatic and exhausting year. And I cannot say how did I cope, because truly speaking, I'm not coping. I just need to go to work because I need to eat. I need means of survival, and unfortunately, that's my work.
Over the last 2 weeks, the surge has hit us in Johannesburg. And we are seeing a huge number of patients requiring ICU admission, requiring admission in a hospital. We've had quite a few deaths every day. And the hardest part is for the nurses as well as the doctors, because the doctors, you look after your patient, you try your very best. You finally get to sleep at 2 o'clock in the morning, and the 2:30 they phone you and says, this patient, please come back. You sort of get your clothes on, jump back into the clothes and rush to the hospital, try your very best, and the patient passed away.
In the first surge, there was more hope, there was faith, more patients going home, rather than the second surge. In the second surge, I don't know what was going on. It was just like a purge rather than a surge. Actually, the loss of life became a norm. It's like part of a 12-hour shift standard procedure that there's going to be life lost. It's terrible. It's so terrible that you'd see patients in critical conditions, severe critical conditions, and there's nothing else that can be done for them. There's no spaces in ICU, there's no beds in high care. The patients' conditions are changing. They're becoming anxious, more anxious because all the other patients that they had been sharing a cubicle with are no more. They've been collected by the undertakers, going to funeral parlors on that trolley, and they're sitting there on these machines thinking about, am I next? And they get so anxious. The conditions drop. They can see the look in your eyes, the look that you wish you can do more, the look of hopelessness. I do not know where this virus is coming from, but it's pure evil.
Healthcare workers say that so many of their colleagues are being infected with COVID-19. They are forced to treat them and all too often calling their time of death.
I myself have been infected. I was infected. I infected everybody that I was staying with. My parents have also been infected. My colleagues, many of my colleagues have been infected. So it really has affected a lot of us, and it has been quite difficult to deal with.
On the walls of our wards in the ICU, there are a lot of pictures, and those are healthcare workers, fellow nurses that have passed away. And it is very sad to see tributes to the nurses on the wall. And the only time that we pay tribute and to these nurses are after they've died, and they could never hear it. And I think that's the saddest part of during this COVID time, is that, so many of our hardest working nurses are the ones that are dying because they are the ones that are exposed the longest and the hardest.
This could be me. I was working with this person last week, and now they are a patient. This could be me. When you've gotten familiar to the pattern, how it goes, how the condition leads to the death, and you can see that they're not going to make it, and they know they're not going to make it because they're familiar with it too. that they can see that you're trying every day very hard. And it's not that they don't have faith, it's that they know how it ends.
The deaths and anxiety have left healthcare workers suffering physically and mentally.
I've been burnt out and I've experienced the most emotional exhaustion ever since the pandemic. I'm demoralized. I'm anxious.
I was heading down a dark path, and I felt that I couldn't take a break, because if I take a break, everyone else suffers.
You come to feel apathetic of going to work, disgruntled, angry, agitated. You can't even commit to say you'll come back and work harder again on your patient, because you might arrive there and the patient is no longer there. You are wrapping body after body after body on this 12-hour shift. I find myself questioning my passion as well. I don't even think we'd ever recover from this as healthcare professionals.
But even though they realize they are under severe strain, most healthcare workers tend to not ask for help.
You kind of have to develop unhealthy coping mechanisms in order to get through the difficulty that is the pandemic. So a lot of what we would do to get through is we would kind of just numb ourselves, that's the only way to get through the day. Just you know that you're not okay, you know that you're struggling, but you have to get through the day. There's 150 patients waiting outside to be seen by you, and right now not the time for you to be emotional about it. And eventually that kind of takes a toll on you. You start getting burnt out, where when you are burnt out, you become even less of a healthcare practitioner, because now you're not treating your patients with the amount of dignity they deserve. You're not doing the right things. You make mistakes.
So at the beginning of the pandemic, what happened was that the nurses, we've set up a healthcare workers care network, which looks after the mental health. But very few of the healthcare workers actually accessed it. And working on the front line, I asked the nurses why they don't want to access mental health. And what they said was that, we are so busy. We don't have time to think about it. We have to worry about our family. What about children? We can't even homeschool them. They worry about the health of their parents, because they can't drop their children off at their parents because they don't want the disease to get to their parents. By the middle of the pandemic, it was a lot of guilt feelings, because a lot of healthcare workers then say, I feel so guilty because I brought home the disease to my husband or to my children or to my wife or to my parents, elderly parents, and I killed them.
Specifically, doctors are very reluctant to seek help. It is seen specifically amongst our slightly older doctors as a sign of weakness. They should just be able to get through this. This is nonsense. They don't need to talk about anything. And this is one of the myths we've been explaining, that it is completely normal to feel completely overwhelmed at this stage. It is not a sign of a mental illness. And talking to someone can prevent a later mental illness.
The pandemic has put a huge strain on the healthcare system and exposed pre-pandemic issues.
The feeling of hopelessness and helplessness, because it's been long enough as health workers been trying to voice out our concern regarding the staffing shortage, the remuneration. Worst part, we didn't even get a salary increase regardless of the job that we are doing during this pandemic. It's been exhausting. It's like we are selling our souls to put the bread on the table, because if you don't go to work, we have mouths to feed. Those mouths that I have to feed, at the end of the day, they might lose me as a breadwinner.
The compounded issues, which is what we started talking about last year, is why is this pandemic so different for healthcare workers? South African healthcare workers are hard workers. They are not afraid of hard work. They are used to working long hours and low resources. I'm not saying it's correct, but they are used to it. The difference is it's personal. They are going to work, but they've got a sick granny in a hospital, their granny in another hospital. They are now going to work and they're seeing their colleagues on ventilators. They are resuscitating their colleagues unsuccessfully most of the time. And then they have to keep on going on, which is what we're saying. They just have to keep on arriving.
And for those who don't take COVID-19 seriously, healthcare workers say it makes their work much more difficult.
You lay your life for the profession. You put your life at risk essentially because of how deadly this virus can be. And then you go on social media and you just see certain people saying things that are not true, and you feel very disheartened because this is your reality and people think it's a joke.
Dr. Antoinette Marriage from the Healthcare Workers Care Network, which is a nationwide support network aimed at assisting healthcare workers and their mental health, says that we have a large mental health problem.
Quite a large medical group reached out to me to provide support groups for nurses in ICU. It was actually at the end of last year, and I helped them set it up. And I followed up recently, how's it going? And the answer I got was, unfortunately, they are too short-staffed, and they are not allowed to attend support groups. The problem we're having is that people are already not coping. They are already not presenting at work. One, because they might have an exposure, but two, because I think they are scared and anxious and burnt out and they are just not presenting. So not only do we have people who are sick, causing short numbers at work, but we also have a large mental health problem as we speak. Healthcare workers are used to suppressing emotions because we have to just put our head straight and just keep going. What's important to understand is the healthcare workers need to understand that they are actually suppressing emotions. And what we suggest is that they don't suppress it completely. They acknowledge it and put it aside, knowing that they're going to need to come back to it and kind of process it at some stage, and then they carry on. The more dangerous is where they absolutely cut it off completely, because that is when it is going to come back.
If you are a healthcare worker in need of help, contact Healthcare Workers Care Network on 0800 21 21 21 or go to the website at www.healthcareworkerscarenetwork.org.za. The network offers free support, pro bono therapy, resources, training and psychoeducation.